Hello. Hello. Good afternoon. Thank you and welcome for this afternoon uh, program. I would want to welcome our panelists this afternoon. We are looking on the effects and how COVID has affected our youths in this country. And before that, I would want to welcome our beautiful Kenyans. We have Ashley Okello, who will be joining us in a short while. We have Joshua Githinji from the Ministry of Health, Brian Magwara, Director of Blue Cross from Kisumu, and Samuel Luchemo, Director and an advocate of mental health. One of our quotes I would want to quote is from Alfred North. He said that the deepest definition of youth is life as yet untouched by the tragedy. We are all in this country and all affected in one way or the other. And our youth, who are our face, who is the face of Kenya, have been affected in one way or the other. And this afternoon, would want, together with my panelists, to welcome them, and we get to discuss on the effects and the way forward on how we will be able to assist or what has been going on since the pandemic started in this country. And for this, I would start with my brother Brian. How has COVID-19 affected the income of the youths in this country? My brother Brian.
Okay, thank you very much. As you know, COVID-19 has really affected the countries in all over the world. So youth cannot be left behind. So youth have been affected. You know, in our country, like in Kenya, a lot of youth depend on Juakali sector and also business, the field, in the markets. And you know, these have been affected. Markets have been closed. There have been people not a lot moving around. People who are working in maybe supermarkets, time has changed. Some which were maybe working till 5 p.m. now have reduced. So there will be a lot of problems that have been issues have been coming out. So young people are really affected. For those in Juakali, their income has not been wanting because even the way the transport have changed, the mode of transport have changed. A lot of things have been required. So, and this is where young people get their income. So this has really affected in terms of getting money, in terms of getting work. Some just work on a daily basis, so they will not be able to get this work. So for me, this is what I've seen, and it's really affected our youth.
Wow. Well, it's indeed, it affected us across the country. And I don't know, and I would ask my brother Samuel, how have the youths impacted awareness on COVID-19? Samuel, are you there?
Thank you. Can you hear me?
Yes, I can hear you. Please, most welcome. Did you get my question?
So, kindly repeat.
I asked that how have the youths impacted awareness on COVID-19? How our Kenyan youth have?
Yes, Kenya, the youths in different sectors mostly, but I will touch on my sector, which is the entertainment and the arts sector. Most of the youth out here have tried as much as they can to create awareness through film, short films, through video, through animation, and through art in the streets, showing people drawings on the streets whereby they show people in masks or people washing their hands and stuff like that. And others have songs and poetry about COVID-19 and so I would say most youth, the way they have impacted it is basing on activity side of it and trying to look for elements that can attract people and can still inform them about different aspects about this disease, because visual arts, or rather, I believe visual makes more impact than just words. So they've done the best that they can
Wow.
through adverts, through poetry, through art in the
Wow.
streets, and a lot. So that's one of the ways which youth have tried their best to impact, to show awareness about COVID-19.
Wow, Samuel, thank you very much for that elaborative explanation. It is true, indeed, as you know, this country, we have quite a percentage. Now, I think it's about 60 to 70% of our population, it's youth. And if we don't use those creatives to cause awareness, then definitely, I think by now, we would be talking about something else. But thank you for such initiative and research that you had to take and involve youth into different creatives. Now, with us, we have my brother Joshua from the Ministry of Health. Maybe we would even bring in some insights on the containment measures that affected the youths. Joshua, what would you share with us, especially the containment measures? From the Ministry of Health perspective and insight, what would you share with us on that?
Okay,
Joshua?
before that, I'll probably want to add on what Samuel has just said. Actually, on how the youths have impacted awareness on COVID. Actually, we all know that art is a very powerful tool for communication, and we've seen the youths really engaged in production of these short films, documentaries, music videos also.
Yes.
We've also seen the youths in the streets coming up with graffiti arts that are really incorporated with the COVID-19 messages. So coming back to what you've asked, the containment measures, we've actually seen containment measures affecting the youth in quite a number of different ways. We've actually seen, first of all, the youths being impacted economically. So with the containment measures like the curfew, we've seen the youths, especially those ones that work maybe during the wee hours or at night. So the periods for business have been reduced, and so you have the youth experiencing a fall or a decline in what they get as income or revenue for their businesses. So I would want to say that's probably one of the ways the youths have been affected by the pandemic, by the containment measures that have been provided by the Ministry of Health.
Wow. I think, Joshua, you are very right. And those containment measures, truly speaking, they have really assisted positively. And I want now to Ashley, most welcome, our HPO.
Oh,
Ashley,
thank you.
are you able to hear me?
Yes, can you hear me?
Yes, I can hear you. We understand the technicalities that have been there, but thank you so much that we have you on board. As a HPO, I would want you to share with us some insights on to what extent have the youth been involved in the decision-making policies that affect them, especially in this country, yes.
Okay, to what extent? I think the youth have been involved recently. Our president, Uhuru Kenyatta, launched the Kenya-MOH campaign, which it's all about youth empowerment. Filling the space, as in the youth need to fill up that space, that having a voice is really important to them. And also, this will enable us to have a space where we can have decision-making policies that affect us as youth. So I think the Kenya-MOH campaign is a very good campaign that will empower the youth in policy-making processes. And also the stimulus package. The stimulus package that was that the government gave to especially youth in the creative space has really empowered the youth and they were able to entertain
Yes.
Kenyans
Yes.
during this time of the global pandemic.
By the way, having said that, as an artist, we are
Yes.
very grateful to our president who came up with that initiative. Believe you me,
Okay.
that thing really helped many youths in the country across the board, and especially when the issue of going through the 47 counties. All youths in the country feel, or especially the artists, they felt now inclusive, and also they felt now they belong to a country.
Yes, very true.
So that we are able to, they felt encouraged, and they felt, oh, they have a space in this country. And now, go back to my brother Brian. We have this issue of being mindful of
Maybe
others.
Alicia.
Yes, please. Yes, Joshua.
Yes, if you don't mind, because we have creatives in this panel.
Yes.
Maybe I'd want one of them maybe to elaborate on the importance of what the government did in
Yes.
providing the stimulus package to the artists that were really that this money really went to. So
Okay.
how important is this to the creative industry? Maybe that's quite important to discuss from a creative perspective.
By the way, it's good to hear either from Samuel or Brian if they would actually, as the beneficiaries of that opportunity. That's right, Joshua. Thank you so much for reminding me on that. Samuel, who is going first? Is Samuel or Brian? Samuel?
What I can say about it is, well, to those who, the stimulus package was very instrumental to the ones who received it.
Yes.
I can say, basically, basing on the film and a number of film got those stimulus, were able now to employ other filmmakers in their projects and stuff like that to make it better and much more intriguing. Like, you can see a series thing out called Techno out of it. There's a movie called Medicine Man, and I believe also Ridey, and others which came out of it because of those stimulus package. So it all depends on. It was very instrumental, but it was just how can I say? There's a section of creatives who got it, and then the biggest chunk were not able. But the ones who received it helped them a lot. As much as we can say, it's very beneficial to any person who received it, and yeah, and it helped them elevate us from one way or another, and help other creators better.
Oh, sorry. Thank you so much. I think there is an interruption on something
On your end.
there. Yeah. Samuel, I can't get you very clearly. I don't know whether it's from my side or where.
Okay.
Hello?
I'm saying mostly.
Yes, please.
Yes. Can you hear me?
Yes, please.
Can you hear me? So
yes, I can hear you now.
Yes. So the people who received the stimulus package was very instrumental for every creative who received it, and it helped them be able to elevate other creatives out of it. And I will recommend mostly the work of the Kenya Film Commission, which did a splendid job in giving a number of creatives those stimulus package. A good friend of mine called Robert Dongo from Kisumu, who received it and made it a better film that will soon be released, and many others we can see, like Tekken TV series, which was released by a guy called Jared. He will release his production, and many others, even already yet Medicine.
Wow.
There's a film coming soon called Medicine. So yes, so I would say a number of filmmakers or and people got elevated out. For musicians, a number of them who are able to create songs out of COVID-19. A few who got it, they
Wow.
are elevated themselves. Poets, even poets, yeah, and a number of them. So obviously we understand that it couldn't like help every creative in Kenya, but the number that it helped, it's still an impact one way or another. That's my view of it.
Wow. Wonderful. And we appreciate all those production and we appreciate the contributions they've made and we appreciate also the support of Kenya Film and also that of the government. I want to ask Brian a very interesting question. And this one also I witnessed. How mindful are the youths on COVID-19 measures? Before you come in, I operate and work with youth groups in Nairobi, kwa Ruben, kwa Njenga, and I could see, some of them wearing masks, others not, and so that concern really affected me. So how mindful are the youths on, other youths? Are they mindful of others' welfare or their parents during this COVID-19? What is your experience? What is your advice would you give to the Kenyan youths?
Thank you very much, Boresha. I know I work with youths in Kisumu, different groups. That is, for us, we
Yes,
those called children and youth, be from the age of 14 to up to 25, 26. So, first of all, I'll start with the question that you said earlier. What
yes,
have youth also done in this field? Before I go to how mindful they, I would like to say that there have been a good contribution of young people, like in Kisumu, we have for me where we work with youth, we have our clubs which had called us and told us about the same that you are asking. Also, the youth who are between 17. We should not forget the 17 years, the 16 years. They
yes,
were not wearing masks. Parents were buying masks for
yes,
themselves, forgetting about these young people, the youth who are between 16, 17. Some, their youth, you never know their age, that they are under 18 or that. So they called us and they said, we need to
yes,
see how we work as young people and educate people from the informal settlements
yes,
on the importance of
yes,
wearing masks. Our youths went out. We were able to get masks, get resources from the masks,
yes,
from supporters, and the children were able to go and help
yes,
them learn how to put on
yes,
masks, how to wash their hands, how to keep distance. Because when COVID started, it was
yes,
new to all of us. It
yes,
was too hard to start wearing masks that you don't know anything
yes,
about it. And we have seen
yes.
also them going to distribute soap for us,
Wow.
like glucose. We bought soap, sanitizers, masks, and also, like they say, some who are good in art
Oh,
did shows just to educate young people in different informal settlements to reach out to them and also provide hand washing points in different part of the informal settlements and helping the young people who are forgotten on how to wash their hands and the importance. So when I talk about mindful now, I know still there have
wow.
been a lot of myths. A lot of people have talked that these things, Corona is not real. Oh, Corona is just a game. It's a political game. Oh, there's lies. We have not seen any relative of ours. This was something that politicians, other leaders
Correct.
were doing. Young people, some of them will hear them. But what I would say, most of them
Yes,
now are taking it as important. And I know as young people I've seen in the slum area, sometimes you walk with mask and people are like, you're taking this thing so serious. Why are you wearing
exactly.
mask? So a lot of young people didn't take it serious at that time. But now that it's coming closer to home, near us, before we used to hear from the news, there are two people, there are three, as much as the Ministry of Health were talking about it, giving guidelines. So, like for us, we did even posters where young people will stick.
Yes,
Some young people will do even write in Manila papers and stick in different informal settlements. But people didn't see it as serious. They saw it as young
yes,
people who or just giving information from the Ministry of Health, not seeing as young people who are caring for other young people. So now they are seeing it through, and many are following the guidelines. Some are still not, but it's something that we as young people need to continue to work on. It's not something that everyone will take it at once, but we need to remind them. Even the Bible says, remind them every day.
Wow, that's powerful, Brian. It's important to be mindful of others' welfare and to get to know that all of us are safe, especially during this time of pandemic. Ashley, I'm glad that you are back again. I just wanted to hear from you, as I'm sure a youthful officer as HPO, how has your social life been affected by this COVID-19 as a youth? Ashley, are you there? Ashley, I'm losing you.
I think she's
Okay.
muted.
Okay.
Hello,
Can
Ashley.
everyone hear me? Can everyone hear
I
me?
can hear you. I can hear you. I don't know whether you got my
Okay.
question, Ashley.
Yes, I did get your question on social life.
Thank you.
Yes. Our
Thank
social
you.
life has really changed ever since we were in lockdown. We aren't able to go to social gatherings.
Wow.
Example, churches, yeah. And even in terms of celebration, we can't really go into to attend weddings. Yeah, and also in terms of also the educational institutions being closed down due to the COVID-19, which has now made an impact in terms of the negative side, where more youths are becoming more depressed because you are in a very confined space. You're just working from home, or you're just able to just move around within your estate, and you're not able to go to another area.
Yes.
And so mental health issues have really been on the rise. Yeah, especially youth just secretly suffering from depression and anxiety. Yeah,
Correct.
I think that's how, since the social life has been disrupted, I think that has been an impact on the youth in terms of mental health well-being.
Actually, you brought in a very powerful and concern. This issue of drug abuse, mental health, has really
Yes.
affected many youths, especially in the slums. And something has to be done. And these are conversations that we need to keep it going, so that we have stakeholders, we have professionals, we have people who would come, put our heads together and see how we're going to rescue most of these youths. And I appreciate, that's why I asked Brian that question, mindful of other youths. And I appreciate again Brian, because he also touched again on the myths. And even you, in your response, you've touched again on the closure of the educational institution. And this thing has really, it's actually global, and it's around, it's affecting on nearly every family, I can say, because in each family we have a youth. And so these are concerned, and I would want even to plead even to the listeners and other stakeholders who are listening to us, that these are conversations that we should keep it going, because something should be done, especially on the mental health and on the issue of the drug abuse and substance, especially this time during COVID, so that we can be able to find a solution, even as creative arts. We see how good we can be able to save the situation and move them to an area or a level that they are able to take care of themselves. And for this, I would want to bring in Joshua. Joshua, how has the closure? Yes, please.
Yeah, I just wanted to, just if you can give me 1 minute,
Hello.
just to clarify. Listen. Yeah, I wanted to talk
Oh, thank
about
you.
the
Thank
drug
you.
issue. I wanted to talk about the drug
Brian,
issue.
continue.
Yeah. Blue Cross works mostly with the issues of drugs and substance abuse
I'm
in the
losing.
country.
I'm losing you, Brian.
I don't know
Brian,
if you're getting.
Brian, I'm losing you.
Are you getting me?
We can hear you,
Okay,
Brian.
come again.
Okay. Yes. I was saying that Blue Cross works on
Okay,
mostly
thank
on
you.
issues of
Continue.
alcohol and substance abuse. That is our main focus. Even when we went to COVID, to help in issue of informing, because that is our main. So what we are doing is that in like in Kisumu, we have 5 offices. In all our offices, we have counselors and we have people scheduled for issue to talk on, for counseling session for issue of substance abuse. And
Wow.
it's true, we have received a lot of calls on issues of substance abuse because mainly when we went to work together with the Ministry of Health in Kisumu County, uh, working together, we went in as experts on issues of alcohol and substance abuse. So all our posters, all our messages, we are experts on issues of alcohol and substance abuse. Then the Ministry of Health will help us on issues of COVID-19 and train us and work with us in partnership. So if anyone in Kisumu also working has issues, can still contact our offices and also
Wow.
get counseling support on issues of substance. Most of the children, we have had a big number of school-going children who got into addiction, not only addiction or using of alcohol, being that they're home and it was available in the homes because bars were closed, and with friends who were doing secret
Wow.
parties with alcohol for high school children and all that. So it's something that we all need to work together to do that.
Wow, Brian, that is so kind of you. And I'm calling upon many others who would come upon. There is
Yes,
also
and
the issue of
I have
GBV, gender-based
one
violence.
thing I'd like.
Yes, Joshua,
Yes,
proceed.
and there's one thing I would like to also
Joshua.
say. Yes, mostly I'd say COVID-19 is it's a blessing and still a curse in one way or another. And one thing is people. Uh, it's not like I'm defending it, but people have come up to blame on everything on COVID-19. The fact is, everything that is currently happening is what has been existing. It's just that it has been accelerated. So COVID-19 is not really the reason for it. It's just the elements within society which has to be corrected. Because with with these elements, if these
Wow.
elements are still within the society, let's say like the pedophiles are more now because of certain issues within their background or how they are brought up. And the elements of teenagers who are
Yes.
impregnated because of the other elements of not protecting your children and still not advising your children on certain elements, because I believe other parents who have teenagers back at home, but their teenagers are not impregnated because they added very good values within their children to make them the way they are right now. So all this, COVID-19 is only a health aspect. The other aspects within what has arisen right now is mostly because of what is already within the society. So they're using COVID-19 just to blanket it. It's like saying that corruption has added more now than when it was before, yet it was already there. So even worse, it's just that now people back are at
Wow.
home, so they can see a lot which is happening. But when you're busy doing a lot of things, you could not notice what is happening around you. It's the same way when you're working at home. There's a number of
True.
things you will notice which are within your compound than when you just wake up and go to work or wake up go to school. So all these elements
Exactly.
are have been
Wow.
always there. It's just that people are the ones who haven't been seeing them. But COVID-19 is like an opener, an eye opener to you to get to know what is happening in your society to correct it. Washing hands is an
Wow.
element which has been there, but we didn't take it seriously until now. So all this, we should not like blame COVID-19, but we should understand the elements that we need to correct within our society to make it better. That's my answer.
Wow.
Yeah.
Samuel, we are talking about values, our cultural values. You know, those are the
Yes.
fundamental things that or each family, each Kenyan should be able to embrace so that we bring up a good society and also equip our youth so that as they grow up, they know the right thing, you know, avoiding the wrong things. I think you're very right. And that one calls upon every one of us, of course, starting from as a panelist, as a moderator, other Kenyans who are listening to us, and what Brian is doing, and what even the Ministry of Health is doing, especially the health promotions. I mean, that's something that we are very grateful. And for this, I would want to bring in Joshua, the coping mechanism that the youth have adopted during this COVID. Maybe if you could share with us some insights. You know, you've been working with many
Thank you.
stakeholders. I'm sure you've interacted a lot with the youth.
Thank you, Alicia. Maybe before I go to that question, I'll probably want to
Yes,
go
please.
to what you had asked. I think it's Brian, on how mindful are the youths on COVID
Yes,
and 19 measures. I actually wanted to add that
yes,
we have youths out here who are very mindful of these COVID-19 preventive measures, the society.
yes,
But at the same time, we have youths who are really going towards the different direction, who are really not following what the government is saying in terms of protecting themselves against COVID.
yes,
Like,
yes,
as Samuel has just elaborated, COVID has
yes,
come as a blessing in disguise, in a way that has made the youth to be very innovative. In a way, we've seen youths in the society or in the past 3 months, we've seen them volunteering in coming up with hand washing facilities that are really up to the standards that the ministry requires. We've seen
yes,
those washing facilities, like you have one which have two pedals, the one that you use to
yes,
maybe bring out the soap or something, and the one that you use
yes,
probably to make the water flow. So
yes,
I want to give an example. Like about 1 month ago, I was in
yes,
Madare, and I was really shocked by what I found in that place. You know that most
hmm,
parts of Madare seems to be like a slum or something.
yes, yes,
And I
yes.
went to this place. I found that there was no one wearing any mask,
Oh no.
and I was actually shocked, finding myself like I was the only person wearing a mask in a whole
Yes,
crowd of like 200 people. And I
yes,
passed by somewhere where youths were seated, and I heard them asking me that,
yes,
we daktari, in Swahili, we daktari, unaenda kutibu nani huko ndani? You see, so these are some of the things we, as a government and as the creative industry, we should really think about in how we're
yes,
going to get this message out there, in making
yes,
sure that the youths actually follow to the latter this COVID-19 measures. Alicia, you've asked about the
exactly.
coping mechanisms among the youths,
Yes,
and I'd want to point out a few things on how the youths are coping with
okay.
actually COVID. We've seen
Yes,
some of them actually engaging in positive activities. Like we've seen a rise in many youths maybe engaging in the local tourism. As we all
yes,
know,
yes,
our economy really depends on foreigners for tourism. So we've actually seen a rise in
yes,
many youths actually coming up with what do they call it? Touring companies or something. So we've actually seen a rise
yeah,
in that, and we've seen
yes,
many youths also going online and being entrepreneurs online also. So many youths at the moment are actually uh, making money online through different ways. You can't
hmm,
exhaust actually the list of how the youths are actually doing this, because actually,
hmm,
the government was estimating that we've actually lost 2 million people have actually lost jobs since the pandemic hit the country. On the other hand, we've seen youths who are really coping in different ways, as I've said. So they're really engaging in different activities, so to say, negative. We've actually seen most of them going into drug and substance abuse, maybe probably due to different reasons. We've actually seen, due to this use of drug and substance abuse, we've seen youths even to the age of maybe 13, 14, and 15 actually engaging in premature sex. So this is something that we've seen actually happening in the community. So that's how youth in the community are trying to really cope with the pandemic. Yeah, so over to you.
Thank you, Joshua. And that's why it's a going concern to all of us, starting from myself, Brian, Ashley, you, and other artists and other professionals who are there. I've been mentioning this every time. It's everybody's concern, especially in this country. We would want to bring a sound, a youthful image that youth who are upright, because as you know, the youths are the face of the country. They are the energies, and these are the people we are looking upon to. And that's why I appreciate what Samuel and Brian and any other artists and creative arts and organizations are doing in regard to the youths in this country. I don't know why it's like we are almost winding up. We're only having a few minutes, around 10 minutes or so to wind up. And for this, then I think I'll have to bring in Ashley to share her parting shot, because I would want to give each one of us 2 minutes, because I'm seeing like we have only 10 minutes to wind up our program. And so I will start with Ashley. It's your parting shot. Then we go to Samuel, Brian, and then we finish with Joshua.
Okay, for my parting shot is to just applaud my fellow youth for being bold and courageous during the global pandemic. In terms of COVID-19 has brought so much into perspective, in that we have realized that one stream of income is not enough, and we need multiple streams of income to sustain us in the future. So we've seen youths just getting into the social media platforms and creating YouTube channels so that they can have that extra income, that extra passive income. We have seen youths come up with online businesses just because there is the containment measures that were put in place by the government. This did not stop us. We were able to go further and even make our business be visible in the social media platforms, especially promoting the businesses in Instagram, Facebook, YouTube, and people have really supported these youths that have taken up these initiatives for themselves, just to add that source of income in their life. And that is, I think, something that we should just applaud us, my fellow youth, and also,
Wow.
Yes.
Thank you. That's powerful, Ashley, and continue doing good. Continue being innovative. Continue empowering our youth to greater heights. Thank you so very much. Thank you. Now welcome Samuel. What's your parting shot?
My parting shot mostly I'll focus mostly on the mental health. During this time, a number of people who lost their jobs and creatives who cannot do maybe certain productions because of regulations and stuff like that. People who cannot do an event and stuff like that. I would advise you, before you get into depression, find somebody to talk with, have a support system, your friend, your relatives, any person who you can share with, the better. And I would also advise now parents, talk with your children, get to understand who they are, what they're doing, what they really like you in life, than pushing them to do what you want them to do. It's better for them. And also getting to understand how to avoid gender-based violence within the society, and getting to love your sister, your mother, getting to love your couple, or rather your wife, and all this. Because at the end of the day, we are all human beings, and no one is an island. We all need each other. So the main thing that I would like to say is, when you're depressed or when you're stressed, find somebody
That's
to lean on,
that's
because
right.
that is the most important thing. And not blame COVID-19, because, as I said, it's a blessing and a curse in one way. Just you to find ways how to change that narrative and make it better for your life,
Wow.
because nothing is impossible. And I believe everything can be changed to a unique way, because you're changing the life today. So
Wow.
you have to get into the system of making sure you make your life better according to the life today.
Wow. Powerful, Samuel. Thank you so very much. I hope the youths are listening out there, reaching out, getting advice, seeking some solutions in the right way to make them better and much better, to be the best
Maybe,
and
maybe
change this
Alicia,
world to a better place to live in. Uh, yes, please.
Alicia, if I can come in,
Joshua,
yeah, I'm asking if I could
please.
maybe interject the discussion. So I just wanted to point out that we have
That's
comments
okay. That's okay, Josh.
from people. Maybe you can probably take people through the comments that are coming in from our attendees or people who are following through the discussion before we probably wind up. Yeah, if you don't mind. Thank you.
Maybe
And
Joshua, maybe
I can
maybe
come
Joshua, if you
in,
could
do
take
my
it from there. I'm having some technicalities.
Brian, you were saying something
yeah.
before we lost Alicia?
No, I was saying that I can come in before as I do my prediction, but also comment on some of the comments, because it's good to also work with them. Like, for example, Frank is talking about how young people have been affected, which we agree. COVID-19 has really affected a lot of young people, but because he says that even before studies, so mine maybe Kurish's point is that different organizations, different companies and government also should come in and also, as they have started, but they should continue to create more opportunities. Because I see this is the same thing Atieno Catherine is talking about, like youths are the backbone, but and they have been affected. What can happen? So it's still that we youth create opportunities. Apart from us alone create more opportunities, is that government should put other measures to make this young people's business to get to thrive, and also to create more job opportunities among other young people who are jobless right now. And for those who are saying that we are doing a good work. Thank you. So as I do that, Sam, I know Joshua will take. I just want to give my parting shot because we know we have more comments. That I was just picking the one that I can talk about.
Yeah.
Maybe the last one I can before I say is Tianoi. Yes, there is opportunities for us as young people to look forward in 2021. COVID-19 is not yet gone, but we should see what can we do as young people to make sure that we deal with this COVID-19. Because now is December, we are getting into 2021, and we don't want this to stay with us. We know they have talked about the vaccine, but apart from a vaccine, that we as young people should take this opportunity to educate other young people, to take the guidelines that have been put in place as serious as possible. This is the only way we can fight COVID-19 pandemic. So my parting shot is this. I want to thank
I would
It seems we've lost Brian.
Brian.
Yeah, it seems.
Yes. I'd like to say something on the opportunities. The aspect of you can only create an opportunity when you're open-minded to receive that opportunity. I would believe that a lot of opportunities are around every person, but you do not need to be spoon-fed to know where that opportunity is, because the government can do much that they can, and we need to work ourselves, so that the only way we can make sure that these opportunities work is one to make it work. Mentioning the government. Remember, we government in the aspect of we are the people who put them to power. So and the government. So which kind of element can you bring on board so you can work with the official government that's in power right now? So I believe people share their value and their worth as a person, and to understand how they can network and know other people to make their lives better.
Thank you. Thank you so much, Samuel.
So I hope you can add
Sorry.
anything so that we can.
Yeah.
We've lost you, Samuel, for a bit there, but I hope the message is driven at home. So I just wanted also to give my closing remarks. So as Kenyans, we are known to be as a nation which is very resilient. I just want to urge the youths out there to know that COVID-19 is not the end, and COVID is here to stay for quite a long time. So we really have to think around how we really have to do our business. Or for that case, I really want to urge the youths to take advantage of the online space. Actually, Kenya is among the top countries in Africa, so to say, in terms of internet penetration. So I want the youth to take up the challenge and really engage in going into online businesses and online stuff to maybe make the future bright. So I'd also want to also say that during this festive season, I'd want to urge the youth, since we are the ones who are majorly responsible on how the pandemic is going to progress. Actually, Elisha said earlier that 60 to almost 80% of the population of this country is actually the youths. So I'd want to urge them to actually consider not traveling up country for this time, because actually we are living in abnormal times. These are not the times that we've been living previously, that when this time comes, you actually pack your bags and everything, you want to go up country. So for the youths who are actually living in the major cities and towns, I would actually want to urge you to consider not traveling to up country during this festive season. So I'll thank you guys for all the contributions in this discussion. They've been really productive and very informative for that matter. I'm seeing Rachel, you've joined us.
Yes, yes. Thank you, Joshua. Mine is to start with a big vote of thanks to the panelists for the wonderful discussion. I will tell you one thing I loved about this session. It was a youth-driven discussion. Not, many times people go on the table discussing the youth, but the youth should be the ones to be discussing about their problems and their issues. And it's good to see young people working in different sector. I know Brian is in civil society sector, supporting, and in the non-profit world. I know some Luchemo, you also split in between being a producer, and you're doing also a lot of social work, including big up to Talanta Mtani project, which is one of the initiatives you're doing, building talents and all that. And I'm hoping we can use such platforms to also be able to empower the youth. Also, Joshua, and Ashley for being young people in the Ministry of Health in this time of global crisis. We are trusting you to be sitting on the table and helping to make the right decisions, especially when it comes to the strategic approach that such big ministries as the Ministry of Health are making towards actions and interventions going towards empowerment of the youth. So that has been amazing. And I would like to just support you guys by reading a few comments. I know we are almost out of time, but I'll read a few comments so that at least we can also hear the voice of the all the viewers who are tuned in. Frank, you're saying the COVID-19 pandemic has disrupted every aspect of our lives. Even before the onset of the crisis, the social and economic integration of young people was ongoing challenge. Now, unless urgent action is taken, young people are likely to suffer severe and long-lasting impacts from this COVID-19. You see, even youths who are supposed to be busy in studies are idle at home and streets engaging in bad behaviors. So that's Frank. And then there was Emily Murkomene said that great work, very interactive session, knowledge reloaded. Keep it up. Atieno Catherine, you're saying that backbone of this nation, the predicament they face, they should be really looked into by the government. That is the youth. I'm assuming that's what you meant. Then also Sianoi Marima, you're saying that, Collins is saying very good presentation. And Sianoi Marima, you're saying, do you see opportunities for youth in mitigating the pandemic in 2021? I think most of the panelists have spoken about this, what needs to be done differently. And you're saying you are a World Health Organization consultant for community engagement, Marima. Thank you for joining us and also for having supported the Boresha Afya Jenga Jamii Audiovisual Festival as a juror. Your input and your contribution to the youth has been noted and is appreciated. Then we also look at James Lamotta. He said hello to all of us from Italy. Thank you guys. Thank you so much for tuning in. And as we finish, I'll just like to once again thank our panelists, thank our moderator, Elisha Nakali, who unfortunately got technical hitches towards the end. And for those insightful discussions, I've heard from the conversations that the youth have made a great contribution. We are looking at Brian here, Samuel. They are really young people who have made a huge impact in their communities. So that is evidence. So during the COVID-19 period, people should stop saying that the youth have not made a substantial contribution. The youth have been making a substantial contribution, even in the slum areas. Go to Kibera, go to other areas, and you'll find that. The other thing is, I've heard about innovation. The youth have innovated a lot throughout this time. They've come up with a lot of things. We saw the president the other day giving somebody a tender to supply beds to our hospitals. That's the kind of innovation that we want to continue with. We also saw somebody like Morris Betzer, who came up with a thermometer, a locally made thermometer at a very cheap price. So there are many young people also who are doing the right thing and taking advantage of this crisis. And of course, I've heard from this discussion that the youth are the future. So as the youth, we need to embrace and take this leadership position. And as I end, I'm going to say that leadership is never given, it's taken. If the youth don't step it up, they will never get to the table to make decisions which concern the majority of the population in the world. And once again, on behalf of the Division of Health Promotion, I wish to say that we've come to the end of our panel discussions. It's been a wonderful 2 days of deliberations, and every content that we covered in the 4 panel discussions was actually covering the content that emerged from the submissions that were put in the festival. So many producers addressed the issue of the youth, others addressed the issues of mental health, others address the issue of how communication is being done, health communication, and others address the issue of retrenchment of people during the COVID-19 pandemic. And so we highlighted those 4 topics, and I've had enough panel discussions to discuss this, but this is not the end. After this panel discussion, we're going to still screen some of the productions that were selected in the festival. We're going to be screening them until up about 5 p.m. And at that time, we're going to invite the head of the Division of Health Promotion to officially come and close this virtual festival. But on behalf of every panelist that has been here, I want to request all the panelists who are here with me right now to help me by clapping for all these filmmakers who've done and creatives who've done such a fantastic job in creating this content that has made it possible for us to have the first ever health promotional festival in Kenya. So with that, I'm going to ask you guys in the panel to help me congratulate all the creatives and celebrate them for the wonderful work that they did. So in 3, 2, 1, action. So thank you very much. Celebrate you. We celebrate you for the wonderful work that is done. And we appreciate you, and to every young person who's doing something to make a difference in other people's life, we celebrate you, and we are looking forward even to have more of these sessions. Maybe the head of our division will be telling us maybe on a quarterly basis, so that we keep engaged. This engagement between the creative industries and the Ministry of Health, and young leaders who are also working with the Ministry of Health, like Brian, who's also a Mandela Washington Fellow. We should come together and come up with these creative solutions, as we have also done with the Boresha Afya Jenga Jamii, which I believe is a unique idea, a very timely idea that has brought a lot of value when it comes to health promotion. So congratulations to everyone, every team member, the audiovisual technical working group, all the moderators who moderated the 4 panels, and all the viewers who joined us religiously, panel after panel. We thank you. And finally, I just want to say a big thank you to the partners that have supported us all through. We want to say thank you to the Kenya Film Classification Board for the support. We want to say thank you to the World Health Organization, who gave us a great member of the jury. We want to say thank you to CDC, US CDC in Kenya, for giving us also assistance in the jury. We also want to thank individuals like Dr. Zipi Okoth, who was our chief of jury. We want to thank Steve Okwani, a producer in Kisumu, who was also in our jury, Yoland Matsitsa from Hillcrest School, and all the organizing committee of the Boresha Afya, and finally, the Ministry of Health and the President of the Republic of Kenya, for this is a 1 in a million projects that has been done, and we are looking forward to see how artists are going to continue in terms of the collaboration with the Ministry of Health, and together we are going to build a better and greater Kenyan society. So with that, from us to you guys, we say bye-bye. Please go back to our Facebook page, our YouTube page, Division of Health Promotion, and watch the remaining productions until 5 p.m. We'll have a brief live session at 5 as a closing ceremony of this event. Thank you very much, and have a good evening. Thank you. Thank you, guys. Thank you.
Namaste.
Okay.